Today, we're going to discuss something that's both medically important and personally meaningful for many individuals living with diabetes. The focus is on how circulation and intimacy are affected by high blood sugar, and more importantly, which 3 vitamins can support better blood flow and wellness in this area naturally and safely. Diabetes is more than just a blood sugar issue. Over time, elevated glucose levels can damage the inner lining of blood vessels and nerves. This can lead to poor circulation, particularly to the extremities and the pelvic region. As a result, many individuals notice a decline in sensitivity, stamina, and intimacy. These changes can be emotionally challenging and physically frustrating. Fortunately, nutritional science offers support. Certain vitamins can assist the body in repairing blood vessels, improving insulin sensitivity, and boosting natural hormonal functions, all of which play a key role in both general health and intimacy. Let's start with vitamin B3, also known as niacin. This water-soluble vitamin helps widen blood vessels by increasing nitric oxide production, a natural vasodilator. Improved vasodilation means better blood flow, especially to the areas where it's needed most during moments of closeness. Additionally, niacin supports healthy cholesterol levels, which is vital for heart and vascular health in diabetics. Next, we have vitamin D, a crucial player in hormonal regulation and immune function. Studies show that low vitamin D levels are associated with poor blood sugar control and lower testosterone levels, especially in men. Supplementing with vitamin D under professional guidance can improve insulin sensitivity and support a healthy libido, energy levels, and mood. Our third key nutrient is vitamin E. This fat-soluble antioxidant has been shown to protect and nourish blood vessels from oxidative stress, something diabetics experience at a higher rate. By promoting healthier vessels and reducing inflammation, vitamin E can improve circulation and nerve health, both of which are essential for physical responsiveness and intimacy. Of course, these vitamins are not magic pills. Their benefits are most noticeable when they are part of a balanced lifestyle that includes proper blood sugar management, regular physical activity, and a nutrient-dense diet. Monitoring levels with the help of a healthcare professional is essential, especially since excessive supplementation of fat-soluble vitamins like D and E can have side effects if taken improperly. In closing, remember this: circulation and intimacy are not separate from your overall metabolic health. They are deeply connected. By supporting your body with the right vitamins, healthy habits, and mindful choices, you're not only improving your intimate life, you're also protecting your heart, your nerves, and your long-term vitality. Always prioritize safety, consistency, and holistic care, and never underestimate the power of small, daily nutritional choices in reshaping your health from the inside out. Diabetes is a condition that impacts the entire body, and one of the most overlooked areas it affects is circulation, which directly influences physical sensitivity, stamina, and intimacy. When blood sugar levels remain high over time, they begin to damage the lining of blood vessels and nerves, especially in the smaller capillaries and arteries that supply oxygen-rich blood to various parts of the body. This damage can significantly reduce blood flow, particularly to the lower limbs and reproductive organs. As a result, many people with diabetes may begin to experience issues related to reduced sensation, lack of arousal, fatigue, and a general decline in intimacy. These are not just emotional or psychological concerns. They are physiological outcomes of compromised circulation. What often begins as minor numbness or tingling in the feet and hands can gradually extend to reduced responsiveness in more sensitive areas. For men, this may manifest as difficulty in achieving or maintaining firmness, while for women it may lead to dryness or decreased sensitivity. These changes can be subtle at first but tend to worsen over time if blood sugar control is not properly managed. In addition to the physical barriers, such changes may also lead to frustration, lowered self-esteem, or relationship strain, making it a complex issue that requires both medical attention and emotional support. The hormonal imbalances caused by insulin resistance further add to the problem. In men, low testosterone levels are frequently seen in diabetic individuals, which affects libido and energy. In women, changes in estrogen and other hormones due to poor glucose control may lead to decreased desire and mood fluctuations. This hormonal disruption, combined with reduced blood flow, creates a situation where intimacy feels less satisfying or even becomes a source of stress instead of connection. It's also important to understand that these complications don't happen overnight. They result from years of neglect, poor dietary habits, lack of movement, and unregulated blood sugar. However, the good news is that much of this damage is manageable and in some cases reversible with lifestyle changes, proper blood sugar management, and the right nutritional support. Simple things like walking daily, managing stress, eating whole foods, and incorporating key vitamins can make a big difference. That's why education, awareness, and proactive self-care are essential for anyone living with diabetes who wants to maintain not only their physical health, but also their personal and intimate well-being. This topic must be discussed with both compassion and clarity, especially because many individuals feel embarrassed or unsure about how to bring it up. But there's nothing shameful about wanting to feel connected, vibrant, and healthy in all areas of life. When you treat your body with the respect it deserves and give it the tools it needs to function properly, you're not just managing a disease. You're reclaiming your vitality and quality of life. Vascular health plays a central role in maintaining energy, strength, and vitality throughout the body. For individuals with diabetes, the importance of supporting the blood vessels through proper nutrition cannot be overstated. The blood vessels, ranging from large arteries to tiny capillaries, are responsible for delivering oxygen and nutrients to every organ and tissue, including the heart, brain, muscles, and reproductive organs. When blood vessels are healthy, circulation is smooth and the body functions optimally. However, in diabetes, high blood sugar levels can weaken and damage these vessels, leading to stiffness, narrowing, and reduced blood flow. Over time, this can contribute to complications such as neuropathy, heart disease, and diminished sexual health. Fortunately, targeted nutritional support can protect, nourish, and even help repair these critical vascular structures. Nutrients like vitamins, minerals, antioxidants, and plant compounds play a protective role against the oxidative stress and inflammation commonly seen in diabetics. For instance, certain vitamins help to keep the inner lining of blood vessels, known as the endothelium, strong and flexible. This lining is essential for regulating blood pressure, clotting, and overall vascular tone. When it becomes damaged, the risk of hypertension, plaque buildup, and impaired circulation increases significantly. Proper nutrition provides the raw materials your body needs to keep this system functioning smoothly. It's not just about avoiding complications. It's about enabling better energy, clearer thinking, and a healthier physical response in daily life. Nutritional deficiencies are far more common in people with diabetes than most realize. Poor dietary habits, over-reliance on processed foods, and increased nutrient losses due to high blood sugar levels all contribute to a state where the body lacks the tools it needs for repair and protection. Specific nutrients like vitamin C, vitamin E, magnesium, and omega-3 fatty acids are known to support vascular function. They help reduce inflammation, protect against oxidative damage, and improve the elasticity of blood vessels. Meanwhile, B vitamins help in improving blood flow by reducing homocysteine levels, a compound linked to cardiovascular damage when elevated. These nutrients don't just benefit the heart and brain. They are also crucial for proper blood flow to reproductive organs, supporting better intimacy and overall well-being. Including these nutrients through a balanced diet, or when necessary, high-quality supplementation can result in significant improvements in vascular performance. Leafy greens, fatty fish, nuts, seeds, berries, and whole grains are rich in compounds that benefit circulation. At the same time, avoiding foods high in trans fats, excess sugars, and refined carbs reduces the inflammatory load on the blood vessels. Hydration also plays a key role in maintaining healthy blood volume and flow. These simple yet powerful choices, made consistently, can dramatically reduce the risk of vascular complications and enhance quality of life. The truth is, circulation affects everything, from how fast wounds heal, to how well the brain thinks, to how fully one can enjoy moments of physical connection. Without proper blood flow, Organs suffer, energy declines, and physical responses weaken. That's why good nutrition is not optional, it's foundational. For individuals managing diabetes, understanding and prioritizing vascular health through food is one of the smartest and most empowering steps they can take. When the body is given what it needs, it has an incredible ability to heal, strengthen, and thrive. Vitamin B3, also known as niacin, is one of the most powerful yet underrated nutrients when it comes to improving blood flow, supporting healthy cholesterol levels, and enhancing overall vascular health. For individuals with diabetes, niacin plays a particularly valuable role. Diabetes often causes narrowing and stiffening of blood vessels due to prolonged exposure to high blood sugar. This can lead to poor circulation, especially in areas like the legs, feet, and reproductive organs. Reduced blood flow not only increases the risk of complications such as neuropathy and heart disease, but can also contribute to decreased physical energy and intimacy challenges. Niacin steps in by helping the body widen its blood vessels, a process known as vasodilation, which allows for smoother, more efficient circulation throughout the body. Niacin works by stimulating the production of nitric oxide, a natural compound that relaxes the inner muscles of the blood vessels, causing them to expand. This improved flexibility helps lower blood pressure and ensures that oxygen and nutrients can reach cells and tissues more easily. In practical terms, this means better heart function, faster recovery, improved cognitive performance, and enhanced physical responsiveness. For those struggling with cold hands and feet, tingling sensations, or intimacy issues related to poor blood flow, niacin may offer gentle, natural support when used responsibly and under guidance. Another important role of niacin is its ability to help balance cholesterol levels, a crucial factor for people with diabetes, who are at a higher risk of cardiovascular disease. Niacin has been shown to increase HDL's good cholesterol while reducing LDL's bad cholesterol and triglycerides. By improving the lipid profile, niacin supports overall cardiovascular health and reduces the chance of arterial blockages. Clean, flexible arteries mean better blood delivery, not only to major organs like the heart and brain, but also to areas important for physical intimacy and hormonal function. This dual benefit of improved blood flow and lipid control makes niacin a uniquely effective nutrient for diabetic individuals seeking to boost their circulatory health naturally. However, it's important to use niacin carefully. In higher doses, especially in supplement form, niacin can cause side effects like flushing, a warm red, or tingling feeling often experienced in the face and chest. While this reaction is usually harmless and short-lived, it's still essential to consult a healthcare provider before starting niacin supplementation, particularly for those already taking medication for cholesterol or blood pressure. In some cases, extended-release niacin may be recommended to minimize side effects while still offering the cardiovascular benefits. Food sources of niacin include turkey, chicken breast, tuna, salmon, brown rice, and legumes. These foods provide niacin in a natural form, along with other nutrients that work synergistically to support vascular health. When included in a balanced diet, they contribute to long-term improvements in circulation, energy, and overall well-being. Vitamin D is often called the sunshine vitamin, but its role in the body goes far beyond bone health. For individuals with diabetes, maintaining adequate vitamin D levels is essential for regulating both hormonal balance and insulin sensitivity. Hormones are chemical messengers that control nearly every major function in the body, including metabolism, energy production, and sexual health. In people with diabetes, especially type 2, insulin resistance is a common problem, meaning the body's cells do not respond properly to insulin, leading to elevated blood sugar levels. Vitamin D plays a critical role in improving this response, helping cells absorb glucose more efficiently and supporting better blood sugar control overall. Low vitamin D levels have been linked to a higher risk of developing type 2 diabetes, and among those already diagnosed, deficiency can worsen glucose management. This nutrient helps regulate the function of the pancreas, the organ responsible for producing insulin. When vitamin D levels are sufficient, the pancreas is better equipped to produce and release insulin in response to blood sugar levels. Additionally, vitamin D receptors are found in many tissues throughout the body, including muscle fat and immune cells, indicating its widespread influence. Its presence helps these cells become more sensitive to insulin, allowing for smoother uptake of glucose and reducing the need for the body to produce excess insulin. Beyond its effect on blood sugar, vitamin D also plays a key role in maintaining hormonal balance, which is critical for energy, mood, and physical intimacy. In men, studies have shown that low vitamin D levels are associated with lower testosterone, a hormone essential for libido, muscle mass, and overall vitality. By optimizing vitamin D intake, many men may experience improvements in natural testosterone production, energy levels, and even mood stability. In women, vitamin D supports estrogen regulation and has been linked to improved mood, reduced PMS symptoms, and enhanced overall hormonal harmony. This hormonal support can positively influence emotional well-being and physical responsiveness, both of which are crucial for healthy, intimate relationships. Additionally, vitamin D has anti-inflammatory effects, which is particularly beneficial for diabetics who often deal with chronic inflammation. Inflammation not only interferes with insulin signaling, but also contributes to the damage of blood vessels and nerves, two key systems involved in maintaining healthy circulation and intimacy. By reducing inflammation, vitamin D helps preserve the integrity of these systems, supporting both metabolic health and physical wellness. Vitamin D is unique because it can be synthesized in the skin through exposure to sunlight. However, many people, especially those with darker skin tones, limited sun exposure, or who live in colder climates, often don't get enough. As a result, supplementation becomes necessary in many cases. It's important to have vitamin D levels tested and to follow a healthcare provider's guidance when supplementing, as too much vitamin D can lead to imbalances or toxicity. Ideal sources of dietary vitamin D include fatty fish like salmon and mackerel, egg yolks, and fortified foods such as milk and cereal, though food alone is often not enough to reach optimal levels. Vitamin E is a fat-soluble antioxidant that plays a vital role in protecting cells from damage, supporting circulation, and maintaining nerve health. For individuals with diabetes, this vitamin offers multiple benefits that go beyond basic nutrition. Diabetes, particularly when poorly managed, increases oxidative stress in the body, a condition where harmful molecules called free radicals damage cells, tissues, and blood vessels. This oxidative damage can accelerate the progression of complications such as nerve damage, poor circulation, and cardiovascular issues. Vitamin E works by neutralizing these free radicals, protecting the integrity of cell membranes, and supporting healthier blood vessels. This protective action is crucial for diabetics, whose vascular systems are often under continuous stress due to fluctuating blood glucose levels. One of the most valuable roles of vitamin E in the context of diabetes is its ability to support and enhance circulation. Healthy circulation is key to ensuring that oxygen and nutrients are efficiently delivered to all parts of the body, especially the extremities and reproductive organs, where reduced blood flow can lead to cold limbs, numbness, or intimacy challenges. Vitamin E helps maintain the flexibility of blood vessels and prevents them from becoming stiff or narrowed by plaque buildup. By doing so, it promotes smoother blood flow and contributes to better cardiovascular health. This can have a positive impact on physical energy, wound healing, and even the body's natural response during moments of closeness and connection. In addition to enhancing blood flow, vitamin E supports nerve function, a system often compromised in people with diabetes. Diabetic neuropathy, which is nerve damage caused by prolonged high blood sugar levels, can lead to tingling, numbness, burning sensations, and a decrease in physical sensitivity. By protecting nerves from oxidative damage, vitamin E may help slow the progression of neuropathy and maintain sensory function. This can directly affect quality of life and personal well-being, allowing individuals to feel more in control and connected to their bodies. Vitamin E's benefits also extend to reducing inflammation. Chronic inflammation is a known contributor to insulin resistance and vascular complications in diabetics. By calming inflammatory responses within the body, vitamin E can help preserve organ function and reduce stress on the cardiovascular system. This anti-inflammatory action also supports better metabolic balance, which is essential for stabilizing blood sugar levels and reducing the risk of long-term complications. Dietary sources of vitamin E include nuts like almonds and hazelnuts, seeds such as sunflower seeds, spinach, avocado, and vegetable oils like sunflower and wheat germ oil. These foods are not only rich in vitamin E, but also provide healthy fats that further support heart health. For those who cannot meet their needs through food alone, supplementation may be considered, but it should always be done under the guidance of a healthcare provider. Excessive intake of vitamin E through supplements can interfere with blood clotting and may interact with certain medications, so it's important to stay within safe limits. Incorporating vitamin E into a diabetic health plan can provide lasting support to the circulatory and nervous systems, both of which are deeply affected by the condition. While it is not a cure, it acts as a powerful protective agent, helping to slow down or reduce the impact of diabetes-related complications. When used as part of a comprehensive approach that includes proper blood sugar management, regular physical activity, and a nutrient-rich diet, vitamin E can significantly enhance overall well-being and vitality. Its antioxidant properties, ability to improve circulation, and role in nerve protection make it a key nutrient for anyone looking to take proactive steps toward better health and quality of life with diabetes. When it comes to managing diabetes and improving overall vascular and intimate health, using vitamins like B3, D, and E can be highly beneficial. However, their effectiveness and safety depend heavily on how they are used. No supplement should be viewed as a replacement for medical treatment or healthy lifestyle practices. Instead, these vitamins should be considered supportive tools, working in synergy with a balanced diet, regular physical activity, stress management, and routine monitoring. Safe usage means understanding the correct dosages, being aware of potential interactions with medications, and recognizing that more is not always better. For individuals with diabetes, who may already be on various medications for blood sugar, blood pressure, or cholesterol, it's essential to approach supplementation carefully and with medical supervision. Vitamin B3, for example, has benefits for circulation and cholesterol balance, but in high doses it can cause side effects like skin flushing or even liver stress. Similarly, while vitamin D is critical for hormonal balance and insulin sensitivity, excessive intake can lead to calcium buildup in the blood, resulting in nausea, kidney issues, or other complications. Vitamin E, known for its antioxidant and circulatory benefits, may interfere with blood clotting if taken in large amounts, especially by individuals on blood thinners. These examples highlight the importance of personalized dosing based on individual health status, blood work, and ongoing consultation with a healthcare provider. It's not about chasing high numbers. It's about maintaining optimal levels that the body can use effectively. Lifestyle synergy plays a major role in determining how well these vitamins perform their functions. Physical activity, for instance, naturally boosts circulation, improves insulin sensitivity, and enhances mood. When combined with the right nutrients, the effects are amplified. Similarly, a diet rich in whole foods, lean proteins, fiber, and healthy fats complements the benefits of these vitamins by reducing inflammation and supporting steady blood sugar levels. Stress management, through practices like deep breathing, meditation, or quality sleep, helps regulate cortisol and supports hormonal balance, allowing nutrients like vitamin D to work more efficiently within the body. All these components work together to create an internal environment where healing and regeneration can occur. Monitoring is another key pillar of safe and effective vitamin usage. Regular checkups, blood tests, and professional evaluations allow for early detection of any imbalances or complications. They also help track progress and ensure that any supplement regimen is tailored to the individual's evolving needs. For instance, checking blood levels of vitamin D can guide appropriate supplementation rather than guessing a dose. Monitoring cholesterol and blood pressure helps assess the impact of B3, while tracking markers of inflammation and clotting can guide the safe use of vitamin E. Without this kind of oversight, even well-intentioned supplement use can result in unintended side effects. Ultimately, true health improvement comes from consistent, balanced action, not quick fixes. Vitamins are powerful allies, but they should always be integrated into a broader lifestyle approach that prioritizes healthy food, movement, emotional well-being, and responsible self-care. With the right guidance, steady habits, and ongoing monitoring, it is entirely possible to experience better circulation, improved energy, enhanced intimacy, and more stable blood sugar, all in a safe and sustainable way. Education, awareness, and mindful choices are the foundation for thriving with diabetes and living a more vibrant, connected life. In conclusion, managing diabetes goes far beyond just keeping blood sugar levels in check. It involves nurturing the entire body, especially systems like circulation, nerve function, and hormonal balance, which deeply impact both overall wellness and intimate health. Vitamins B3, D, and E each play a unique and powerful role in supporting these systems. From improving blood flow and lipid balance to enhancing insulin sensitivity and reducing oxidative stress, these nutrients can offer meaningful support when used thoughtfully and consistently. However, it's important to remember that vitamins are not standalone solutions. Their true potential is unlocked when they're paired with healthy lifestyle habits, such as a balanced diet, regular physical activity, proper hydration, and effective stress management. Safe usage and regular medical monitoring are essential to ensure these supplements work in harmony with your body and any existing treatments. Always seek professional guidance before starting any new supplement, especially if you have underlying health conditions or are taking medications. By taking a proactive and informed approach, individuals living with diabetes can improve not only their metabolic health, but also their energy levels, physical responsiveness, and quality of life. You deserve to feel strong, connected, and in control of your health. Small daily choices, supported by the right nutrients, can lead to powerful, lasting results. Let this be your reminder that managing diabetes is not just about restriction, but about restoration and renewal.